This lecture walks you through the metabolic equations which appear on the ACSM certification exams at the Certified Exercise Physiologist level or higher. So really, we'll talk about in this lecture the background for the metabolic equations, or also called metabolic calculations. We'll go through what the equations mean and do some practice problems. So this is another way that you can use them in exercise prescription and programming. So you're going to need to be able to, work on these throughout the test. They do not have a huge amount of questions on them, maybe 5, but you want to be prepared and be able to do the best that you can. However, don't spend excessive time focusing just on the metabolic equations if this is an area where you are struggling. We'll talk about the units and the conversions that you'll need to be comfortable with in order to take the test. So be sure that you have your guidelines book available, and if you have any of your XPhys labs, particularly your work in power labs from XPhys1 and some of the other labs like the Bruce protocol or the YMCA protocol from XPhys2, where you're going to need to be able to work between units. So as I mentioned, it's another way for exercise prescription. You want to know the energy cost, again, in VO2, or METs, in order to meet exercise guidelines. And then how is often used is certain clients may need a specific intensity, either high or low. If you're working with athletes, you can actually base their programming workload on a percent of their VO2 max, or if you have clients that are clinical patients, heart disease patients, for example, someone gets chest pain at a certain level of intensity, you want to be able to have that person exercise at a certain speed and grade on the treadmill or a certain resistance on the exercise bikes like the Monarch, so that they don't get chest pain. And so basically you're going to work backwards to calculate speed and grade. So we'll give some examples of this in the following slides. So here is your ways for prescribing exercise intensity. You should be familiar with the heart rate reserve method, the first one. That is your Carbonin formula, also known as that. So 220 minus age minus your resting heart rate times the intensity percentage, and then you add the resting heart rate back in. So again, you should have covered this in your other classes. The VO2 reserve, again, your max VO2 minus your resting VO2 times the intensity percentage. Heart rate method, the straight percent, 220 minus age times the intensity percentage. VO2 method, again, so looking at percent of your VO2, and of course also the MET method. I know this is covered in exercise testing and prescription, so we're going to just divide VO2 by 3.5 to get METs. So there are specific formulas and calculations. ACSM focuses on walking, running, and you can see the speeds listed here. So the speeds for walking are most valid at 1.9 to 3.7 miles per hour. You're going to convert those to metric, to meters per minute. Running, 5 miles an hour or higher. Cycling, so typically on the Monarch cycle, arm ergometry, and stepping on a box. So stepping up and down, up a step or box, versus using the elliptical. So the emphasis is always going to be on walking, running, and cycling, because those are the most common modes of activity. Now, if you have somebody that they're walking faster than 3 miles an hour, or they're jogging slower than 5 miles an hour, still use the appropriate equation, whether they're running or walking, but it's a little bit less accurate when you're out of those ranges. But, still use the one that for the mode of exercise that they are doing.